Have you ever wondered whether a medication you take every day could be quietly placing extra strain on your heart without you realizing it? Throughout my career, I have seen thousands of hearts up close, witnessing both remarkable strength and silent decline. Time after time, I discovered that some of the most serious damage was not caused by unhealthy eating, smoking, or inherited conditions alone. In many cases, it involved medications prescribed with the best intentions that produced unexpected effects over time. My name is Vital Aging, and my mission is to help older adults better understand their health. This video is not meant to create fear or encourage anyone to stop taking prescribed medicine. Instead, it is designed to give you clear, research-based information so you can have more informed conversations with your healthcare provider and better understand how aging changes the way your body responds to everyday medications. One of the biggest changes that happens after the age of 60 is that your body no longer processes medications the same way it did decades earlier. Your kidneys gradually become less efficient at filtering waste and medications from your bloodstream, while your liver slows down the process of breaking down many commonly prescribed drugs. As a result, medicines can remain in your system longer, increasing the chance of side effects or unexpected interactions. What makes this even more important is that many older adults are prescribed several medications at the same time. While each drug may have been carefully tested on its own, far less is known about how multiple medications work together inside an aging body. This is why reviewing your complete medication list is so important. Understanding the full picture can reveal hidden problems that may otherwise be mistaken for nothing more than the natural effects of getting older, allowing you and your healthcare provider to make safer, more informed decisions. To understand why this matters so much, let me share the story of someone I'll call Clarence to protect his privacy. Clarence was 74 years old, a retired electrician who had always taken pride in looking after his health. He walked several miles every morning, ate balanced meals, kept his medical appointments, and followed every instruction his doctors gave him. Yet despite doing everything right, he found himself becoming overwhelmingly tired. This wasn't ordinary fatigue that disappeared after a good night's sleep. It was a deep exhaustion that affected every part of his day. Painful muscle cramps repeatedly woke him during the early hours of the morning, and he began noticing that his once sharp memory and quick thinking were slowly fading. Several doctors reassured him that these changes were simply part of aging, but when If you regularly rely on over-the-counter pain relievers, it's important to understand that these medications can affect more than just aching joints or sore muscles. Drugs like ibuprofen, naproxen, and diclofenac work by blocking enzymes that produce inflammation, helping reduce pain and swelling. However, those same enzymes also play a role in protecting your blood vessels and maintaining healthy circulation. When these protective mechanisms are reduced over long periods, blood vessels may become less flexible, blood pressure can gradually rise, and the risk of heart attack or stroke may increase, especially in adults over 60 who already have underlying cardiovascular conditions. In fact, health authorities have strengthened safety warnings over the years to reflect these concerns. If you find yourself taking these medications almost every day, it's worth discussing safer long-term pain management strategies with your healthcare provider. Depending on your situation, topical anti-inflammatory gels may provide relief while exposing your body to much lower amounts of medication. Other approaches, including physical therapy, regular low-impact exercise, weight management, and targeted stretching, can often reduce chronic joint pain without placing additional stress on the heart. Some people may also benefit from evidence-supported supplements, such as omega-3 fatty acids or curcumin, but these should only be considered after discussing them with your healthcare provider to ensure they are safe alongside your current medications. The goal is never to stop treatment on your own, but to find the safest and most effective way to manage pain while protecting your long-term heart health. The third medication on our list is one that many people never associate with heart health because it is commonly used to treat acid reflux and heartburn. Medications known as proton pump inhibitors, including omeprazole, pantoprazole, and lansoprazole, can be extremely effective when used appropriately. For many individuals, they provide significant relief from painful digestive symptoms and help heal damage caused by excess stomach acid. However, when these medications are taken continuously for months or even years without regular review, they may contribute to nutritional deficiencies that can have wider effects throughout the body. One of the most important is vitamin B12, a nutrient essential for healthy nerves, red blood cell production, and proper brain function. As we age, absorbing vitamin B12 naturally becomes more difficult, and reducing stomach acid can make that challenge even greater. Over time, low B12 levels may contribute to persistent fatigue, memory problems, tingling or numbness in the hands and feet, poor balance, and reduced energy. Another nutrient that deserves attention is magnesium, which plays a vital role in maintaining a steady heartbeat, supporting muscle function, and regulating hundreds of chemical reactions throughout the body. Long-term use of acid-reducing medications has been linked to lower magnesium levels in some individuals, increasing the possibility of muscle cramps,